It was a fine day for a march in Seattle. People poured into the streets by the thousands. The healthcare system in the United States is broken, they said. They were marching because they have a dream of healthcare for all, paid for by the government.
We're the only industrialized modern country that doesn't have, that doesn't cover all its people. It would be the best value for our dollar by far.
People who never thought that they were going to be forced between making the decision to make an insurance payment or a mortgage payment are now saying, why am I forced to do this? And it's because there's no single payer health care.
That we're all just a pink slip away from not being able to take care of our health. And it's scary. It shouldn't be this way. And there's people that, obviously don't have health care at all that are already suffering that.
I'm self-employed and single. And so, from my own perspective, I feel pretty vulnerable, as an individual, that if I purchase a high deductible catastrophic coverage through group health, with which if I were really to be hurt, it wouldn't do me any good. And I think that that's, for many of us, that's the situation that we're stuck in.
My name is Senji Kanaeda, as a Japanese Buddhist monk. I live here for 6 years. I'm a permanent resident of the United States now. Why I'm here, I think is, if any government spend the money for arms or a nuclear weapon, instead of it, they can use the money for healthcare or education, for much more social service, welfare. And also, practically, if I have ulcer or something, or cancer, I have to return to Japan for taking fibroscope or X-ray. That's, one X-ray in this country is much more expensive than airplane ticket round trip from Seattle to Tokyo. I'd like to change, such a situation. This is rich country, must be, but medical care not so rich. I think now you will have a possibility to change this country. New president, I really expect. That's why I'll be here.
This is the biggest flaw in our democracy, that we believe that we're the greatest democracy on earth, and yet healthcare is not a right.
When I look at the system and how much wasted money goes to military spending, that we have over 700 bases around the world, the occupations in Iraq and Afghanistan, that money, if we just pulled some of the money out of the military programs, that we would have plenty to transition to a single payer, full coverage for anyone care, and that the Medicare program is the perfect solution. Just let everybody prescribe to the Medicare program.
With one nuclear submarine, we could have health care if we eliminate one nuclear submarine.
And I'm a nurse practitioner dedicated to providing primary care. And the only way that people will have unfettered care that they need is a single payer source, which includes all risk pools, that evenly distributes the risk so that everyone can enjoy health care that should be a right.
Everyone needs to be covered. As soon as they're born, they need to be covered.
Oh yeah, no, Japan is not, we don't have a best medical care system, but much better than this country, At least we never hesitate to go to the hospital, and all ordinary Japanese people. They don't need to worry about so much about money for how to pay and after the medical care or X-ray, or medicine. But in this country, going to the hospital looks like a very special thing. From my observation, that's not so good.
I think it's a mixed bag, but the lion's share of providers are certainly for single payer source. The complexity of submitting claims to various payers whose top priority is to find ways to deny the claim over years gets very, very taxing and consuming.
And I'm very sad to see that many people don't have a medical insurance. That is not good because next country, Canada, is quite different. I don't think Canada is more rich country than America. This is almost same country. You can change. Canada is not so different situation. But they have much better medical care system.
The march snaked through downtown, much larger and more united than many demonstrators had anticipated.
Single payer! Oh my God! Are you kidding?
Across from the rally, there were counter-demonstrators chanting USA, USA, and who will pay, who will pay.
There's still more background work that needs to be done to get, I think, as many Americans as possible agreeing that single health care for all is where we need to go. And I don't know that everyone is there. Many are, but not enough to make it such a groundswell of interest that literally people are climbing the fence at the White House demanding it. We haven't seen that yet.
If the people speak more loudly or make more big movement, maybe I expect the government will be able to have it someday. But this is a chance, very important time, I think, for American people.
The U.S. movement for universal, single-payer health care has never been larger. Demonstrators say that their success depends on building an ever-stronger movement and on exceeding the limits of the current administration. The health of the nation, they say, is indeed the health of the nation.
Why am I so depressed and confused all the time? It's like I don't care about anything anymore. All I want to do is watch Fox News all day. I feel like I don't even know what's going on around me.
If you are experiencing symptoms like these, you could be suffering from corporate fasciitis. Corporate fasciitis is a disorder that affects millions of Americans each year. You are not alone.
Doctor, what causes this sickness?
Corporate fasciitis is an MTD. It's a media-transmitted disease. Let's take a look. First of all, let's open up the mouth. Say ah.
Ah.
Good. Any other symptoms?
I feel afraid all the time.
You see, as mainstream media enters your head, the misinformation releases a contagion. This contagion triggers a process similar to brainwashing. This disorder, which spreads throughout the central nervous system and eventually throughout the entire body, causes extreme cynicism and social lethargy.
So my television's poisoning me.
Not just your television, unfortunately, but also the radio and print media.
So what can I do, doctor?
Well, fortunately for you, there's an easy solution. What you need is Indymedia Presents. Why, with a weekly dose of independent media from Pepper Spray Productions, you can be back to your old self again, enjoying life, and most importantly, thinking for yourself.
Now I feel hopeful again, and I can take an active part in my community and the world around me. Thanks, Indymedia Presents.
Warning: regular ingestion of independent media may cause increased consciousness, acute political awareness, counter-hegemonic activity, enlarged cranial capacity, excessive hopefulness, and bloated critical thinking abilities. Ask your doctor if Indymedia Presents is right for you.
Pepper Spray Productions is pleased to announce the release of The Leader number 17. Named for that useless bit at the beginning of an old film reel, The Leader is a compilation of activist videos. The Leader number 17 is a double release containing 2 DVDs with a total of 16 short pieces. The idea is that when you get a copy, you're supposed to show some or all of it to others as part of building the movement. Over the next while, we will feature selections from The Leader number 17 on this show. Getting The Leader number 17 is like getting a mini film festival in a 2 DVD set. Visit our website, peppersprayproductions.org, for more information.
I think this is the time where it's time to introduce the current chair of the Harry Bridges Center for Labor Studies out of the History Department at the University of Washington, Dr. Jim Gregory. Jim?
So this is a special day, one of a number of special anniversaries in a, guess what, special year. 2009 is now officially, as of yesterday, it has officially become Washington's Labor Heritage Year. Yesterday, Governor Gregoire issued this proclamation declaring 2009 Washington Labor Heritage Year. The Harry Bridges Center and the King County Labor Council and the Pacific Northwest Labor History Association wrote the resolution. Steve Conway and our friends in the legislature took it to her and she said yes. Hopefully she'll say yes to a few other things. But this one's important. Let me just read it. Whereas the state of Washington has a unique labor history that has made it a leader among states in securing workplace rights, establishing civil liberties, equal rights, and the dignity of all workers, and in recognizing the importance of labor unions. And whereas organized labor has been vital to the progress of American democracy, helping to secure not only higher standards of living, but also higher standards of citizenship, giving workers the ability to counter the power of money with the power of many, both in the workplace and in the halls of government. And whereas many of the episodes that frame our state's sense of historical identity involve worker struggles and labor issues, and whereas 2009 presents the opportunity to acknowledge several important anniversaries: the Spokane free speech fight of 1909, 100th anniversary. The Seattle General Strike and Centralia Massacre of 1919, 90th anniversary. The Great Longshore Strike of 1934, 75th anniversary. And the 10th anniversary of the WTO Battle of Seattle. Now, therefore, I, Christine O. Gregoire, Governor of the State of Washington, do hereby honor the heritage of the labor movement in our state. And I encourage all citizens to involve themselves in educational activities that foster understanding of the history of working people and the role of labor organizations in Washington State. Hear, hear. Thank you, Governor. Thank you, labor movement. This state has so much it owes to the men and women who have fought for workplace rights over the centuries, the century plus, over the decades and right up to the present. So let me tell you a little story. And Andrew, I think if the lights could come down just a bit. Little bit. Okay. At 10 a.m., the morning of February 6th, which fell on a Thursday that year, a sharp whistle sounded in downtown Seattle. It was the signal to stop work. On job sites throughout the city, men and women put aside their work, grabbed their coats and hats, and headed for the street. More than 100 unions had voted to stop work at that hour, and more than 60,000 workers responded. Among them were Teamsters and streetcar men, building trades workers, pressmen, longshore workers. The waitress union joined the strike, shutting down all of the city's restaurants. Hotel maids and lady barbers also joined. It was the greatest display of working class unity in this city's history, and the first declared general strike in American history. It electrified the nation and the world. Journalists had flooded into the city, and now the telegraph lines hummed with the news that the strike was actually underway. This was a solidarity strike. The unions of the Central Labor Council, meeting in the original Labor Temple over on Union Street near 6th, had agreed to strike in support of shipyard unions that had been on strike already for 2 weeks. They were fighting for a wage increase that the federal government had promised during the war and then reneged on when the war ended. But the feds and the metal trades unions had shut down the shipyards, and now the unions of the city joined together to shut down the entire city. The stakes were high. This is just months after the end of World War I, and a little more than a year after the Russian Revolution. Some of the strikers are wobblies and revolutionary socialists, hoping that this is the start of a revolutionary sequence. Most of the strikers have different goals. They have watched during the war as profiteers get richer and richer while wages are mostly frozen. They think it's labor's turn, not just to raise wages, but to raise dignity and authority. They're also worried that the shipyard strike is a harbinger of an open shop movement, a plan to derail and stop the progress of organized labor. The strike is impressive at first and surprising. Authorities had been expecting violence. The mayor asks for federal troops, and 1,500 soldiers from Fort Lewis are dispatched to the city, taking up positions in the National Guard armories. Mayor Ole Hansen had worried about violence, and so he deputized more than 2,000 citizens, conservatives, as special deputies who are armed and ready to back up the police department in case of violence. Machine gun emplacements are seen on the streets of Seattle. But the Central Labor Council is on top of things. There's no violence at all. Indeed, what everyone notices is how quiet the city is. Few crowds gather. The General Strike Committee has organized 300 war veterans into a force called the Labor Guardians, and they move through the streets urging people to disperse, not to do anything to provoke the police. Meanwhile, the labor movement is providing essential services. Food kitchens are operating in many of the labor halls, feeding 20 to 30,000 citizens, strikers during the day. Teamsters are delivering supplies to hospitals, delivering milk to places where children, families with children can get it. But the strike is also failing. By day 2, certainly by day 3, it's clear that the hope that this gesture of power and solidarity will help the shipyard workers is not to be. The feds dig in their heels, and local authorities, backed up by the major newspapers, are becoming more and more hysterical. The expression of workers' solidarity has scared many people, and conservatives now have the upper hand. On Saturday, several unions tell their members to go back to work. Others soon follow. The Central Labor Council officially calls off the strike on Monday, February 11th. It has lasted 6 days. The strike failed, but it did not fail. It served as a model for other big strikes that year, huge strikes in the steel and coal industries, and another general strike in Winnipeg. It served as a model for the big strikes of the 1930s, including the general strike of 1934 in San Francisco and another in Minneapolis. It was a model because it demonstrated two things: that workers would indeed come together in impressive displays of solidarity, and secondly, that they could do so peacefully. That big strikes could be powerful without turning into massively violent confrontations. General strikes have come to be rare in the United States, and we should ask ourselves why. They're not rare everywhere. This is last week. This is Paris. Last week, the Union Federations of France declared a general strike, a one-day general strike, 2.5 million people in the streets, transit, work disrupted and stopped. This is one of my favorite little slides. This is the airport in Paris. Planes not going anywhere, trains not going anywhere, subway not going anywhere, people not going anywhere except into the streets, where they were protesting the government's inaction in the face of this great recession that we are in. Inaction on the one hand, and plans to cut jobs, cut services, cut the social safety net, cut education. Does that sound familiar? Does that sound familiar? And what do we do while the plans to cut social services and to throw tens of thousands of public employees out of work are being hatched and worked through in our state? Well, we could talk about that.
Oh, my sisters, oh, my brothers, we've been stealing for these others. Don't you think it's time we shared among ourselves? We don't want them. We don't want them. We don't need them. We don't need them. These parasites who live off someone else. Better turn it around. Turn it around. Take another look. Take another look. Forget what they made you read in the history book. Forget the book. Brick by brick.
You can call me a fool, that's alright with me, I will. If you see this good round world breaking free, yes I will. Yes I will. They say they will incorporate the world over my dead body, over my dead body, over my dead body, over mine. They say they will incorporate the world over my dead body, over my dead body, over my dead body.